A new, faster spreading coronavirus variant, first identified in South Africa, has been detected in the U.S. for the first time. The strain was discovered in two people who don't appear to have any connection to each other in South Carolina. Neither of them reported traveling recently.
We have been doing sequencing already previous to this, and these are the first ones we have identified. While there is no known travel history with these, we also are doing deeper dives into other history that they might have had or exposures.
Other variants first detected in the UK and Brazil have also been found in the United States. Researchers believe they are more contagious. Dr. Krutika Kuppalli joins me now. She's an infectious disease physician at the Medical University of South Carolina. Doctor, thank you very much for joining us. What can you tell us about the two people who tested positive for this variant?
Well, we don't really know too much right now. All we know is that they are two different people in different parts of the state and that they don't have any connection to each other. This is obviously very concerning because without them having any connection to each other, this gives us concern that there may be more widespread transmission of disease going on that we don't know about.
Well, will these different variants potentially force changes in how we're vaccinating?
Yeah, that's another good question. I don't think we know that quite yet. I think that one of the things that we do need to work on is just making sure that we get the vaccine out there as quickly as possible, which is what the current new Biden administration is trying to do. They're trying to ramp up getting the vaccine out there as quick as they can, and also really working to double down on our public health measures. So reinforcing to everyone that we need to wear our face masks, we need to physically distance, use good hand hygiene, and avoid crowds as much as possible until we can work on getting everybody vaccinated as quickly as possible.
And do we know, Doctor, how well do the currently available vaccines handle these variants?
So Moderna came out earlier this week and said that the current vaccine is not affected by the B.1.1.7 or what's known as the UK variant, but it looks like there may be a reduction about a little bit more than six-fold with the B.1.351 variant, which is called the South African variant. Likewise, Pfizer came out and said that there doesn't seem to be any effect from the UK variant, but there might be a twofold decrease in neutralizing antibodies from the B.1.351 South African variant. That being said, they still seem to work very well. What we need to think about is what will happen long term. Even though there's a decline in the neutralizing antibodies from these variants as we go on, and there tends to be more variants, then that could cause problems down the line with the vaccine. So that's why it's so important for us to get the rates of transmission down in the community.
And so what specifically does that mean, Doctor? Should we be taking additional steps to protect against these more easily transmitted strains?
Well, so it's really the same things we've been talking about since last year, right? We need to decrease the levels of transmission in the community so we can prevent onward transmission of the disease. So it's going to take everybody coming together to help decrease the spread of COVID-19. So all the things we've been talking about, everybody really being very vigilant about wearing their face mask, making sure they have a good seal around their nose, around their face, it's laying flat, making sure we maintain our physical distance, making sure we avoid crowds. Really, nobody should be traveling right now unless they have a very good reason to. Really doubling down on all these measures. It's really important that until we can get the vaccine out to everybody, that we remember that we not need to just take care of ourselves, but we need to think about everybody in our community right now. I know it's really hard because we've all been in this for a long time, but if we want to try and put an end to this pandemic, we need to all come together and really think about how we want to move forward.
And you know, doctor, what about double masks here? Some folks might be wondering, is that something that they need to be doing every time they go, say, to the grocery store or the post office with these more transmittable variants out there?
Well, I think that's something definitely to consider. I think, I would also make sure to look at the quality of the mask you have. You want to have a good, tight fitting mask, at least a couple of layers that is going to fit you well. So, we talk about things like the K95 mask. You want to make sure that it has a snug fit. So if I had to choose between one good fitting mask or two ill-fitting masks, I would choose one really good fitting mask. So there's a couple things to think about when you're deciding what type of mask to wear.
What about this question, Doctor, of herd immunity? Is the country close to reaching that at all?
Not just yet. Herd immunity is going to come through vaccination. And so we need to continue to ramp up vaccination. We need to continue to roll out the vaccine. And then the other thing, we are struggling with, and we're out there trying to work on this, is really getting people to understand why the vaccine is important. We have a lot of questions to answer for people. A lot of people are interested in the vaccine, but they have a lot of questions, and that's understandable. The two vaccines we have right now are a new platform of vaccine that was developed quickly, and people want to understand why it was developed so quickly, and they want to understand that it was developed in a safe and effective manner. There were no corners cut, and I think that's everyone's right to understand, and so we're out there explaining that to people and making sure that people feel safe about it. And so I think that slowly but surely we'll get to that point, and people will get vaccinated, but it's going to take time. We spent a lot of money developing this vaccine, but unfortunately we didn't spend a lot of money working to get the messaging out there and engaging our communities. And that's something we are needing to spend time doing now. We need to engage our communities at every level so people understand why this is important for them to get vaccinated. And we will do that. It's unfortunately going to take some time.
All right, well, that's exactly why we wanted to have you on today, Dr. Krutika Kuppalli in South Carolina. Doctor, thank you so much for taking the time and explain some of this evolving science to our audience. We really appreciate it.
Thank you.